We are so excited to announce the newest sponsor of the Success NP podcast. Picmonic is a quick and effective aid to help you pass your NP boards. They utilize 2-minute videos that connect difficult to remember facts with unforgettable characters. By tying facts together into ridiculously memorable stories, you'll be able to retain the information for test day. They help reinforce what you learn and track your progress with thousands of built-in rapid review multiple choice quizzes. The use of the intelligent space repetition algorithms automatically adjust to your learning needs, so you'll be reminded to review the right information at the right time, increasing long-term retention. Picmonic is also integrated into the True Learn question bank, so you can study exactly what you need and test your knowledge. Check them out today if you're preparing for board. Link in the show notes. Attention, all nurse practitioners and NP students. Are you tired of feeling the disconnect between clinical rotations and didactic teaching? Say hello to Success NP's clinical booklet guides.
As NPs ourselves, we know how valuable it is to have a resource that helps bridge the gap between clinical and class. So we created the digital resource to do just that. Our clinical booklets cover 5 major NP tracks: psych, adult, peds, family, and women's health. Success NPs wants to create tools and provide support NPs need to thrive in their careers.
So why wait? Check out our Success NP Etsy shop, linked in the show notes, for our digital guides and other digital clinical resources.
Hi guys, welcome back to another episode of the Success NP podcast. I'm your host for today, Jackie. Today, we're back in the pediatric world with a respiratory case that starts off simple, but turns out to be anything but. You'll want to listen closely to the clues and test your clinical reasoning as we follow this little patient's story. Let's dive into the wheeze that wouldn't quit. You're working in a pediatric primary clinic. A 4-year-old boy named Aiden is brought in by his dad. Dad says he's been wheezing for almost a week and it's just not getting any better. You know Aiden as an established patient who has a history of mild intermittent asthma, but this time the usual treatments just aren't working as expected. All right, guys, so as we all know, a history of present illness needs to be reviewed. Let's dive right into that with Aiden. Aiden started with cold symptoms about 10 days ago. Your typical runny nose, low-grade fever, and a mild cough. But then came the wheezing. Dad says that they used the albuterol inhaler, which did help at first, but now Aiden is waking up at night coughing and wheezing more frequently. He's more tired than usual and isn't playing as much. Dad denies any choking episodes. He denies any vomiting, any allergies, and no fever in the last few days, but it's the cough that keeps lingering. You ask about medications. He's only been on albuterol as needed, he says. No oral steroids yet, and no antibiotics. So you dive right into your review of systems. Let's go over his symptoms, or lack thereof. No vomiting or diarrhea, no rash, no recent travel, no sick contacts outside of daycare, mild decrease in appetite, no chest pain, but he does note that his chest feels tight. The next step is a physical exam. So first part of a physical exam, as we all know as nurses, get a set of vital signs. His temperature is 98.9 degrees Fahrenheit. Heart rate is 118 beats per minute. Respiratory rate is 26, and his O2 saturation on room air is 94%. As a nurse practitioner, you perform your physical exam and you note that he is an alert child, but he does look tired. On auscultation of his lungs, you hear diffuse wheezing, worse on the right side, with a prolonged expiratory phase. He does have mild retractions, but no stridor. You note clear nasal discharge, no tonsillar enlargement, and no drooling. He has a regular rate and rhythm, and his abdomen is soft, non-tender. His skin does not present with any rashes and looks to be normal. But you're concerned. It's not clear if this is a worsening asthma flare, a viral illness, or maybe something entirely else. So now that we have our HPI, our review of systems, our physical exam, our wheels are turning, right? We're thinking of differential diagnoses, right? What could this be? So let's think it through. One, it could be an asthma exacerbation. It could be bronchiolitis, possibly pneumonia. Or is it viral-induced wheezing? Is it a foreign body aspiration or atypical infection? So we dig into the story a bit more to find some more clues. We go back to Dad again. We ask, are you sure he didn't choke on anything? This time Dad hesitates. Well, there was that Lego incident last weekend, but I thought he just swallowed it and passed it. Your ears perk up. A week ago, you ask Aiden to take a deep breath and cough. It's a dry, brassy cough. Still wheezing, mostly on the right though. You order a chest x-ray. So on that chest x-ray, we do see what looks like hyperinflation on the right with a mediastinal shift to the left and no infiltrate. Our top differential at this point, guys, we all know what it is. It's foreign body aspiration. So we consult pediatric pulmonology and ENT ASAP. A bronchoscopy is performed, and sure enough, a small Lego piece is retrieved from his right main bronchus. So did you get it right? Our final diagnosis is an unrecognized foreign body aspiration leading to unilateral wheezing and persistent symptoms despite standard asthma therapy. Post-removal, Aiden's wheezing resolves completely within a few days, and Dad is both relieved and surprised. It hadn't occurred to him that the wheezing was due to something stuck, especially given the time frame from when he remembered Aiden playing around with that Lego. So let's go over our teaching points from this case study. Let's go over that. What did we learn from Aiden? Well, for one, not all wheezing is asthma. If the pattern doesn't follow the usual course, expand your differential. Foreign body aspiration can present very subtly, especially in children who don't choke dramatically or can't explain what happened. Unilateral wheezing, hyperinflation, and mediastinal shift are the big red flags here. And maybe not as fancy, but so important is a thorough history. You notice how we had to go back around that second time to ask Dad exactly when he noticed it, kind of more of a timeline. That can make all the difference in your differential diagnoses and ultimately, expedite treatment. All right, guys, I really hope you enjoyed this case study. I enjoyed going through it with you. I hope you found some value in it. If you have a mystery of your own that you've seen in clinical practice that you want to share with us, please DM us on Instagram at @thesuccessnp. And please look at our tools. They're so valuable. We wish we had them when we were in school at thesuccessnp.etsy.com or on our website. Until next time, stay curious and stay sharp.
Thanks for tuning in to another episode of Success NP. We hope today's discussion has shed some light on the diverse career options or taught you how to improve your clinical practice as a nurse practitioner.
Remember, whether you're considering a specialization, pursuing advanced certifications, or exploring non-traditional roles, there's a wealth of opportunities out there waiting for you. Be sure to subscribe to the show so you don't miss an episode and leave us a 5-star review. It helps the podcast grow. The Success NP's podcast is on the World Wide Web, YouTube, Instagram, Facebook, and X. So subscribe to our newsletter for updates on new podcast episodes and other information to help you on your own NP journey. You can always message us at successnpspodcast@gmail.com with any NP podcast episodes or topics you'd like us to discuss.
Until next time, take care. Stay curious and keep advancing your careers as a nurse practitioner. And just a friendly reminder, the information on this podcast is for educational purposes only. The information should not be used in substitute for professional care by a medical provider. The information on this podcast does not represent medical or professional advice or services.
Bye for now.